Everyone, I'm Dr. Ankita and I'll be speaking on rotational stability of toric IOLs, a comparative study. Toric IOLs provide an effective means of correcting pre-existing corneal astigmatism at the time of cataract surgery, but its success largely depends on rotational stability, as even a small degree of rotation can significantly reduce the intended astigmatic correction. So I have included 5 commonly used torics: Clarion, EC toric, IQ toric, Johnson techniques, and Zeiss toric. So of these, as we all know, Clarion, IQ, EC, and J&J are loop haptic acrylic hydrophobic lenses, but the Zeiss is a plate and hydrophilic lens. So the aim of this study was to analyze the rotational stability of 5 different IOLs used during phacoemulsification. The objective was to compare the rotational stability and the visual outcome at 6 weeks following toric IOL implantation. This was a prospective comparative study done from March to May 2025 at Vision Eye Hospital. A total of 500 consecutive patients, 100 in each group, were included, and the patients were divided into 5 groups according to the IOLs: C for Clarion, E for EC toric, I for IQ, J for J&J, and Z for Zeiss. The inclusion criteria was any visually significant cataract with a presence of regular corneal astigmatism between 0.75 to 4.5 diopter, and the IOL power should be between 18 to 26 diopter. The exclusion criteria was any irregular astigmatism or keratoconus or any previous intraocular surgeries, any ocular comorbidities, any intraoperative complication where in the bag IOL placement was not possible. So all surgeries were performed by a single phacosurgeon through a 2.2 mm temporal clear corneal incision. Argus was used for a preoperative axis planning, and Varian was used for an intraoperative toric IOL alignment. Hydroimplantation of the IOL was done, as shown in the video. Postoperatively, we saw the patient on week 1 and week 6. We evaluated uncorrected and best corrected visual acuity, any residual refractive cylinder, and IOL axis, and rotational stability was assessed by using slit lamp photography. This is how we did it. So coming to the results, we included 100 patients in each group, but some were lost to follow-up and some were discarded due to poor pupillary dilatation, which was significantly high in torics. It is 25 to 30%. So only at the end, only we could include 329 patients. This is all the demographic data, age and gender, and preoperative astigmatism, which is not statistically significant. On comparing the degree of rotation at 1 week, group C was more stable with 9% showing rotation more than 5 degree, and group E and Z had more than 5 degree rotation in 17% of the patients. In both the group E and Z, we had 2 patients each who required re-rotation at OT because they had a rotation of more than 10 degrees. At 6 weeks, IQ and Clarion, that is group I and C, both had similar stability, with Zeiss being the least stable. At 6 weeks post-operatively, 92% of group C had an uncorrected visual acuity of 6/6, while group E performed poorly with 68%. The difference across all the groups was statistically significant. At 6 weeks follow-up, Clarion had the least rotation, and that is 3.77 mean, and Zeiss had the highest rotation, 4.58 mean. But the rotation between the groups was not statistically significant. We also compared the slit lamp axis between 6 weeks and baseline between the groups, but it was not statistically significant. As we can see from the bar graph, there is a definite reduction of astigmatism as seen by the pre- and post-operative findings, but they are not statistically significant between the groups. Coming to the discussion, there are few studies, Lee and Chang in 2018, Squat-Muller at 2024 and 2022 with Clarion and IQ, Lee et al. So all of these studies have compared different IOLs, and where mostly Clarion and IQ has performed very well, and the same stands true for our study also, where Clarion and IQ was comparatively more stable and had a better visual acuity. So coming to the conclusion, all 5 toric IOL showed good rotational stability with more than 80% staying within 5 degree of the intended axis at both 1 and 6 weeks. No significant difference was found between the IOL groups. The Alcan, IQ, and Clarion showed a better stability with maximum rotation in Zeiss toric. 2 IOLs, each of EC toric and Zeiss, were rotated at 7 days follow-up, Overall, all IOL groups demonstrated substantial improvement in visual acuity postoperatively, with group I and C showing the highest proportion of eyes achieving normal vision at both follow-ups. And group E had a relatively lower proportion of normal vision due to higher residual spherical power. The limitations of our study was a short follow-up and using an Argus machine, which is a Alcon machine, so maybe it has given a good reading for Alcon IOLs. Thank you. These are my references.
So how are you going to convince us that in your results you don't have influence of the companies?
Yes, that is what I said, that was our limitation, that I have included Argus machine for pre-op.
Is there any study which has actually shown that Argus gives more accurate biometry for Alcon lenses compared to the other lenses?
No, not to my knowledge.
So it is your presumption.
But I have presumed because it is of the same company.
The second thing is that have you actually segregated all these eyes also vis-a-vis their axial lens? Or
Yes. We have included like the normal, we have not taken any extreme of the axial lens.
So what were the limits for your axial lens?
So it was 22 to 20 to 24.
22 to 24 millimeters.
Why do you think is the cause of more rotation in Zeiss?
I think because it is a plate haptic, so maybe it has.
But some people say that plate haptic is more stable and tend to rotate less.
Maybe because the optic and haptic, that length is less in Zeiss, maybe that is a possibility.
What is the material in Zeiss lens as
Acrylic.
compared?
All the material are same.
Zeiss is, I think, it's modified, no? It's not a pure hydrophobic.
No, it's a hydrophilic.
It's hydrophilic, that's
but
what.
acrylic.
Other lenses are hydrophobic.
Hydrophobic, yes.
So we all know that hydrophobic material have more techiness. So IQ, these Alcon lenses, these acryol lenses, they are more techy than as compared to hydrophilic.
Maybe
that may
is
be
it.
the reason, yeah.
Yes.